Hi, my name is Dr. Carla Marienfeld. I'm a clinical professor of psychiatry at the University of California in San Diego, and I've done a lot of lectures on motivational interviewing, teaching colleagues and trainees, and I'm excited to be talking today about the 4 tasks in motivational interviewing. So the 4 tasks I think are most helpful in helping me orient myself to what am I doing when I'm trying to have a conversation in the style of motivational interviewing. So it helps me think about where am I at and what am I doing. So the 4 tasks are engagement, focusing, evoking, and planning. And so we're going to go through those today using an example case. So let me introduce you to patient Mr. S, who comes in saying the medications aren't working. He's a 54-year-old construction worker who's had pain for about 12 years from an injury. He's been on high-dose opioids for the past 5 years. He comes in because he's saying his pain is still an 8 out of 10 on most days, and he spends most of his day in the recliner. He's gained a lot of weight, and he just recently missed his daughter's graduation because he was too, quote, stiff and tired to be able to sit on the bleachers through the graduation. He's very fearful that reducing his medication will result in unbearable agony, and yet he admits that his current life has shrunken to the 4 walls of his living room. So the 4 tasks are really helpful for understanding what am I trying to do right now in this conversation, and what's my role as a clinician. And you can use these to sort of frame or orient yourself when trying to use some of the other micro skills and ideas of motivational interviewing. So we have these 4 tasks: engaging, focusing, evoking, and planning. And so we think of them in this kind of stair-step imagery because they are somewhat linear, but we often can go back and forth between them. So I'm going to use an analogy of going on a walk to illustrate what we're talking about. So when we're engaging somebody, that's inviting them to go on the walk with us. If they don't want to go on the walk with us, we can make the best plan for the walk in the world, but they're never going to get out the door. The focusing in is, where shall we go? Are we walking across the street? Are we going to the park? The evoking is the why. Why are we doing this? Are we going to get some lunch? Are we going to enjoy this beautiful afternoon? Are we going to go have a conversation? And then the plan is, how are we going to get there? Are we going to go down the street and take a right? Are we going to drive to the woods and go through the walk? Those kinds of things we tend to be very good at, but it's important that we don't just jump right into the how we're going to do it before we've invited them to go with us and that they're actually willing to go with us, that we have a sense of where we're going, that engagement, and then the focusing, and that we understand, why are we doing this? What's the purpose of this walk? Because they might be willing, they might have a sense of where they're going to go, but if they don't really have a reason, if you're going for lunch but they're not really hungry, they're unlikely to continue on that walk with you. So I mentioned that they have this somewhat linear stair-step thing. Engagement really is foundational to all of these other things. However, it's not necessarily a one-time event, and you may need to re-engage them as the conversation goes on and attend to that task of the conversation periodically. Similarly, focusing may not be a one-time event. Sometimes refocusing is needed when new information comes out, or the focus may change. Invoking can begin very early, and in fact, asking people the why of why they're interested in something or what they're interested in about can be a really good way to engage them, showing that you're interested, that you understand what's going on. That's how you develop that therapeutic working alliance. So when we talk about engagement, it's establishing that mutually trusting, respectful, guiding relationship. And there's a lot of factors that can go into that. In Mr. S's case, we may want to start by validating his suffering and fear as a way to engage him and show him that this is a safe space and one where we're interested and understand his dilemma. So you might say something to him like, "Mr. S, I can see how exhausted you are. You've been carrying this heavy burden of pain for over a decade, and it must be incredibly frustrating to take these medications every day and still feel like you're missing out on important moments in your life, like your daughter's graduation." So just showing that you understand that can be really helpful. How you phrase that can make a big difference in developing that rapport. So if there's anything that feels insincere or sarcastic or undermining of something that that person's going through, can greatly shift it. So making sure you retain that genuine curiosity and that you're communicating that understanding. The next task we attend to is focusing. And this largely comes from two sources. What did the patient come to talk about and what's on your agenda? It's an ongoing process of clarifying, and it should be a conversation, not a transaction. So the goal is to develop and maintain a specific direction, and it should be collaborative on what that direction is. So for example, you may want to talk about opioid tapering for safety with Mr. S, and he may want to focus on pain relief and how much that pain is impacting him. So a shared focus could become quality of life or improving functioning. So you might approach the situation by asking permission to discuss the relationship between the medication he's taking and his current level of activity. So an example of something you might say could be, I know our main goal is to help you feel better so you can do the things you love. Would it be okay if we spent a few minutes looking at how your current medications are helping with that goal and perhaps where they might be holding you back? So it's just throwing it out there. It's asking permission, which is consistent with motivational interviewing, to get their buy-in. If they say no, you know that you need to pull back and maybe reassess what the focus is and re-engage them and build that rapport. So it's helpful information as well. The bread and butter of motivational interviewing really is evoking, and we often use our ORs, the micro skills of open questions, reflections, affirmations, and summaries in our evoking. And so we want the person to be voicing the reasons that they might want to change. And so we're trying to use our skills to evoke that change talk that then can be used to help make appropriate plans and action steps. So rather than you doing the hard work of arguing for all the reasons that they might need to or want to taper down on the opioids, we want to elicit from them what are some of these reasons that they might want to make a change and improve their quality of life. An example of how to approach this is to explore that discrepancy between the patient's values, being active, wanting to be engaged with their family, and their current behaviors, being sedated because of the opioids or having pain that won't let them sit. So some example statements for evoking might be something like, Mr. S, you mentioned that you feel too stiff and tired to leave the house. How might your meds help that or hinder that? Suppose we are able to make a change to your treatment plan. What's the thing you miss most that you'd like to get back to doing? Again, inviting them into that conversation. The fourth task in a motivational interviewing conversation is planning. And we're pretty good at coming up with plans of things that might be helpful. The key part is really figuring out how to transition into the task of planning. So if you start hearing Mr. S or your patient talk more about when and how and less about whether or why to make a change, then you know that that's a good time to start planning. The plan is really the conversation about the action. What are the next steps going to be? And so it should ideally be something the person's willing to try, and it's relevant to the shared focus of that conversation. So when you start hearing sufficient change talk, signals of readiness, then we might approach the planning task by summarizing the conversation or those change talk statements that you've heard so far and asking a key question to elicit an action or propose a small and manageable step. And again, ideally that step should be something that you heard during the evoking or that the patient actually made a statement about. So for Mr. S, you might say something like, sounds like you're tired of the fog these medications put you in, but you're also terrified the pain will spike if we lower the dose. What are some small steps that we could try to see if your energy improves while keeping an eye on your pain? Again, putting it back on them to make a suggestion. Or you could just ask a broad, open question. What are your thoughts on how to go about trying something different? Those kinds of things can be really, really helpful. And you want to be careful not to just default back to your agenda that gives you that quick and easy resolution or that illusion that you've accomplished something because you've told them what to do, but maybe has little chance of them actually being successful of doing it. So we want it to come from them, and you want to try to choose things that are going to happen the most likelihood for success. So it's the confluence of these four tasks, that engaging of the person, that focusing the conversation, the evoking from them, the whys, the what's, the values that are important to them, and the planning these next steps based on what you've heard from them, that describes those tasks that we need to attend to in any conversation in doing motivational interviewing. So, in conclusion, I hope you've learned a little bit about the 4 tasks of motivational interviewing. And be sure to check out our other videos that describe some of the reflections and the micro skills of motivational interviewing and the spirit and focus of motivational interviewing. Thanks very much.